How has having to Zoom with your patients changed, if at all, the way you do your therapy?
In some ways, I think I'm a better therapist. At least I have been on Zoom because there's a little bit of that time lag that allows me to think about what to say. And I am a much better therapist on Zoom than I am on the phone. I don't know if you noticed when we were talking on the phone the other day, I was interrupting you. And the cadence of the conversation is very different when I don't see your face and I don't have the information about the time lag on the phone that I do sitting here. It allows me to think that millisecond more about what I'm going to say.
Another thing that video chat allows that you could never get in your office, which is
Yes,
that you see your patients in their natural
there's
habitats.
absolutely. And there's so much information I get from that, which they usually don't realize how much I'm paying attention to what's behind. So I meet the cats. Occasionally the kid will come in and say, Mom, assignment for my teacher. I cannot get, can you help me with it? And the mom will say, okay, honey, did you go to this number, blah, 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 blah. And the kid goes, yes, okay. And then this was a kid that I knew in utero. So I'm like, oh my gosh, this is your little boy. He sounds so grown up. And so that, like, you would never get that information otherwise.
So it sounds like you're saying that it in an instance like that, adds to your relationship with your patient because you are able to share some intimacies that are not possible lying on your couch.
Absolutely. But you lose something for my patients, for them to find the spot in their home where they will not be disturbed is almost impossible. I had one patient who tried to have a session in her car, and it turns out that the internet was not great. We could not hear each other in the car. And another patient, well, the Zoom was acting up. And so we had to switch to the telephone. And going in one session from the Zoom to the telephone was very disorienting for me. So I think she was fine with it. She was used to that kind of transition. But for me, it's like, oh, wait a minute, what do I do now that I can't see the person? And it's like I'm practicing in the dark. And the only way I got back into that session was I grabbed my knitting and I started knitting while she's talking, and that worked. Then all of a sudden I could focus on what she was saying, and it took me, I had kind of a 10-second lag where I was not attending to her in the way that I needed to.
Do you intend to do more Zoom sessions even after you are not in lockdown?
I think what will happen is I will get less cancellations because people will say, oh, I don't feel well enough to leave the house, but let's Zoom. And I'm like, I'll be great. Been there, done that, let's Zoom. I think it will really enhance the continuity of care. I think what I'm sensing now for my patients is that they want to be in the office with me and I want to be with them. And so I think it's unlikely that somebody's going to ask, can we resume a telemedicine kind of setup for the rest of our work together? I think that's very unlikely. I think I would discourage it because there's so much about being together in the room. Like, Aaron, it's great to see you. I've never seen that room before. You're very familiar to me. Do we wish we were sitting, having Shabbat together in person? Well, yeah,
Yeah.
we do. We do. It's not the same, but it's an interesting second best.
Well put.